Here with Home Health Success Academy, and welcome to another one of our videos, especially this video series right here. It's part of a 5-part video series in which we share with you guys how to be able to find the right marketers, how to give them expectations, how to train them, and ultimately be able to how to look into them, making sure that they're doing what they're supposed to do. Now, once again, this is the number 4 video of the 5-video series. Let's go ahead and get started. In this video, we're going to be talking about mainly how to provide training for your marketers, because this is possibly one of the biggest things that gets missed when we bring in a new marketer for our company. So let me ask this question. More than likely, when you actually hired, let's say, for example, a caregiver for your company, a homemaker, you guys gave them some form of an orientation, some form of a training. Now, you hired a nurse, let's say, because you're a home health agency. You probably gave them some orientation, training them. You had somebody else survey them, go with them in the field to show them around what's the expectation, give them training on how to do the admissions, how to be able to, make sure that they do the right paperwork. The biggest problem that we see when it comes to marketers now, or hiring marketers in the home health industry, guaranteed more than likely, most agencies don't even have an orientation system for their marketers. They don't even have a training program applied for them. And so how are we going to bring in a marketer, somebody to work for our company, then all of a sudden not have the things that they're supposed to have in order to be able to deliver the services, in order to be able to know what to do? And then we wonder sometimes when the marketer doesn't work out and we say, well, they're just a bad marketer. I always say one thing is that people are not good at what they do is because they weren't trained properly. So if your marketer is not producing for you, they're not following the guidelines, they're not doing things that they're supposed to be doing, then more than likely there was a failure in the system of them being trained. And that's where Home Health Success Academy was created. Our goal with our company mainly is to be able to work with new marketers in this industry, or old marketers, giving them regular tips and strategies on how to increase and be better at what they do in the field. And in the other aspect, we actually work with the owners and administrators of a lot of agencies for the reason that more than likely they don't know what to teach to people and how to market. And so by us being pretty much an extension of the company providing training, that's what we mainly do. Now, of course, Home Health Success Academy also helps people start their own agencies, but our niche area is mainly training marketers so that they can provide services for an agency, because you guys have to understand, marketing is 100% of your profits. That is how an agency stays afloat. That's how an agency remains open, is bringing in patients that you can bill, that you can make money on. So the training that we provide in the whole, services that we do it several different ways, right? So we work with a lot of agencies, whether we come to your facility live and train the marketers in a live setting in your office, and we also go in the field with them, or we also have our online training program through 10xpatientreferrals.com. Now, here's the thing, guys. The beginning of Home Health Success Academy came about because I was hiring a lot of marketers and I wanted to duplicate what I was doing. Things that I was doing in the field was actually working, and I was able to bring in patients. I was averaging somewhere around, but by the height of my marketing career for my own agencies that I've owned, I was bringing in about 120 to 150 patients a month. And those are solid Medicare patients, not counting the Medicaids and not counting the private insurances as well. And so I wanted to be able to, maximize this and say, well, if I want to make more money, maybe I can bring in people that I can train and show them how to do the things I've been doing it, and not the old ways of marketing for home health agencies. And so I started creating videos as an in-service and training for my marketers, expecting them to watch, a full training. We created a 32-hour training program. And then what we did was we wanted them to watch the whole thing once they actually worked with us. Then we did a lot of practice, drilling, and rehearsing, and then we went out in the field with them. And then every day we expected them to actually watch at least 1 to 2 videos from our training program. Ever since then, we've increased that, and we have lots of other videos. We have over 200 hours worth of videos, and it's in our platform. And so a lot of agencies take advantage of that, right? You have to practice, drill, and rehearse. Here's the thing. I can give somebody a concept, but until I know that they can actually apply it, then that's the only way I'm going to know that they're doing what they're doing. Right? It's just like the same thing for anything else. You can watch a video of somebody cooking something, you can see a recipe, read it, and go ahead and kind of know what to do. But when it comes time to actually cooking it, if you don't have the recipe in front of you, if you weren't trained enough, if you haven't done it long enough, that it just comes out of personal memory, then you're not going to be able to make that dish that you want. It's the same thing when it comes to marketing, right? It's practice, drilling, and rehearsing to know what you're going to expect. And if you face something, to know how to be able to respond to that. So what we do is we have a whole training program that the marketers can go through, that you can avail to the training. Actually, the fact that you're watching this video, more than likely you probably join our program or maybe just purchase this particular series right here. And so by providing them that capability, that learning capability, that they can watch it through their phone, through their laptop, through their tablet, or their PC computer at home, then they have the access to these things. And a lot of our marketers don't even watch the videos. They just have the video playing while they're driving from one facility to the other, right? Because that's how it's supposed to happen. So once our marketers have the training, the initial orientation training, what we then do is, before we start going out in the field, we actually sit down with them and we'll give them scenarios. And we wanted to see if they can apply what they learned. So we'll say something, all right, let's play this role. I'm the physician, you're the marketer. Say something to me. They'll say something like, well, hi, my name is John, and I just want to be able to speak to you and, about our services. And then I'll be the doctor and I'll say, you can stop right there, John. We're already working with another agency. And so John needs to know how to handle that particular objections. Typically, other marketers who are not experienced will say, well, here's my business card, here's my brochure, you won't regret it, you should definitely try us. If you change your mind, give us a call. And they walk away. And then that marketer just left donuts, pens, mugs, wasted your money. And do you think that physician is going to call you? No. But guess what? The initial meeting of you and a person, of you and a potential referral source, is not the end of all. It's about the follow-up. So we train the marketers on, number one, how to be able to find the better facilities to go after. And then we show them, this is how you do a presentation. These are the questions that you ask. These are the things that you don't do. And these are the things that you do. And then we put them in the to have the capability of being able to handle objections. What are the different objections that most marketers will experience? We're already working with another agency. I don't have time to meet you, right? Oh, the social worker is not available. Oh, we only use our own home health agency. Oh, we already work with a hospital. Oh, I don't like you. Oh, you're too pushy. Oh, there's no solicitation. You can't even get in front of the social worker yet, and you're already bombarded with all these different objections from potentially just the gatekeeper, for example. So can you handle those objections? And we actually deal with that and teach the marketers to say how to handle that. And then the next thing that we do is show them how to do a presentation. We want to be able to have them learn how to adjust their presentation according to the questions that they ask with the referral source when they have that initial meeting. And then we start giving them closing techniques, right? If somebody's telling me, for example, well, Michael, I like your agency, but we're already working with another agency right now. They're perfect, right? I've heard that a lot where doctor says, well, the agency we're working with are perfect right now. Hey, doc, I completely agree. And I'm glad that you're working with a perfect agency. That's exactly what I want to do. And guess what, doctor? The other physicians that love working with us had said the same thing before they started working with us. Let me ask a question, doctor. From a scale of 0 to 10, how perfect is the agency you're working with? And guess what? When you ask that closing technique, the doctors will say, well, they're a 9. Well, doctor, what's going to make it from a 9 to a 10? Right there alone, I broke his mindset about the agency being perfect, because then he'll share me and tell me what's going to take to get it from 9 to 10. Now, if I can position myself to that physician, to that referral source, that one problem that they're facing, and show them that he or she won't experience that with us, right there alone, I can position myself. Now it's just a beginning of the stage of the communication. Then we put them through the follow-up process. They should be able to understand how to handle emails, how to make cold calls. We'll sit them down and have them make cold calls all day on their training. We want them to be able to know that stuff. We want to be able to see that they can remember a lot of the scripts that we give them, because we give them so much scripts. Because those are things that you're going to learn if you join 10xpatientreferrals.com, if you join Home Health Success Academy's online learning platform, or you have us come into your facility, right? It's even to the part that we work with a lot of agencies out there where we actually manage their home health marketing team. The reason for that is a lot of the owners don't know how to manage, how to evaluate, how to monitor the home health marketers, and they hire us to be that. Instead of paying somebody $70,000 a year to be the home health marketing manager, our team becomes that for them. So you have to have a training in place, because that's the only way that you can have expectations that can be met. Because if you tell somebody, this is what I expect you to do, but imagine I come around and I say, this is what I expect you to do, but let me show you the steps on how I want you to be able to achieve it. Wouldn't that be a lot better? So you need to have a training program available. Do you have a policy and procedure in regards to your marketing strategies? You have policy and procedures how to take care of a patient, how to handle an intake, but you don't have a policy and procedure when it comes to your marketers marketing out there. And I'm glad the fact that you're watching this video, because some form you either have joined 10xpatientreferrals.com or you probably just purchased this particular video series, which is very helpful. But having a training system is such an important thing to have. And so that's the main goal. Have a training system, because if you don't have a training system, then your marketing program is broken. Once you have a training system in place, that's the first step to creating some amazing marketers. But then also comes a part of evaluating, making sure that they're doing what they're supposed to be doing. So that's this portion of this video series, the training portion. It's the 4th video of this 5-part video series. We have one more video to go. If you haven't watched the previous videos, make sure you go back to them. And always understand, when you're done with this video series, don't just watch it once. Really absorb it. Watch it 2-3 times, take notes, and try to apply this to your company. All right? Once again, this is Michael. Always understand that home health marketing is easy when you know what you're doing.